truly terrible time to be camera shy. Even if you don't participate in the age of the selfie, you probably have a profile pic or two. And if you don't like the way you look, it can be a nagging problem. Tonight, we're going to meet some people going to great lengths, some might even say outrageous extremes, to look picture perfect. Here's ABC's Cecilia Vega.
Perfect position.
Triana Lavey is no stranger to going under the knife.
It definitely takes all 5 years.
I like the sound of that.
She's about to have her second surgery in 2 years. This time, it's fat grafting.
That's my first place that I'm putting the fat.
Okay.
This doctor will take fat from her butt and inject it into her face.
I think that we're going to go around the eyes and in the temples, possibly a little bit in the hollows of my cheeks.
All in a seemingly never-ending quest to look better online.
I'm constantly untagging myself.
Triana says a digital image is today's first impression to the world, and you can't escape a bad picture.
The social media of it all has kind of put so much focus on how I look, and it just makes me really self-conscious. The only difference between me and every other person that's getting plastic surgery is that I'm not denying it.
Triana's had plenty of Botox and breast implants.
I don't even remember what real boobs feel like anymore. I don't know anybody that has real boobs anymore.
And she always had a problem with her chin.
Hey.
She didn't like the way it looked during Skype chat.
I wanted to talk to you about this project.
And on Facebook.
My darn chin just bugs the living daylights out of me in this photo.
She decided on a permanent fix, a chin implant.
It sounds like you're going to a pretty far extreme to
maybe
make it work to you. I don't know if people might say surgery. That's a huge commitment.
To me, plastic surgery should be a last-ditch effort. After you've worked out, after you've had good discipline in your diet and exercise.
Her doctor also suggests a nose job.
When you do a chin, sometimes you have to do a little bit more than that to balance the face in the chin.
Okay, well, how are you feeling as you get ready to go in?
I'm getting very excited, starting to border on nervous, so I'm ready to get going.
Okay, ready to rock and roll. This is going to be her cheekbone. This is the chin implant. It curves around the side a little bit. It's a rounded one that's very soft. It's not pointed for her face.
It is 2 hours of surgery on her face.
You look good. Very good, very nice.
Good. Are you happy with everything?
I'm thrilled.
Smooth sailing?
Yeah, I couldn't be happier.
A month later,
Hello.
Hi.
Hi, Cecilia.
Hey, Triana.
Welcome.
Wow. Oh my God.
hello.
she thinks she is finally camera ready.
Here is the quintessential profile shot, which before you never would have put on.
I never would have put that on because my little chin would have been, you know, looking like a little turtle.
Triana isn't the only one obsessed with her virtual self. People are more self-conscious than ever, honing in on every tiny flaw.
I see so many people bringing in a picture of themselves. They say, you know, I was at this party and I took this picture of myself. Do I look like that? I have to bring somebody back to reality and what they really look like. Just because you get one bad picture of yourself and you run to a plastic surgeon's office, you know, is insanity.
It might sound crazy, but more and more people are doing exactly that. 33% of surgeons have seen an increase in patients getting plastic surgery for the sole purpose of looking better on social media.
There's a bunch of young people who are misinformed about what plastic surgery does and want to jump into it and think that this is an art form. This isn't an art form. It's a way to make certain people happy by doing very subtle things.
The nips and tucks might have been subtle, but the reaction to Triana going under the knife to become picture perfect wasn't.
90% of the feedback that I've gotten has been positive. Then there's the angry 10%. And the angry 10% seems to think that I should have spent the money on therapy, that I should have gotten more work done, that I looked better before the surgery.
But it doesn't bother her. The opposite, in fact.
Of course I enjoy the attention that I've been getting from this. Who doesn't? I would be a liar if I said I didn't enjoy the attention.
And now she is even going back for more.
I'm not getting more procedures done for more attention. I'm getting more procedures done because I want to maintain and prevent aging.
What's your biggest fear about plastic surgery?
My biggest fear of plastic surgery is that I'm going to end up looking like Donatella Versace or Jocelyn Wildstein.
But that doesn't stop you.
It doesn't stop me because I trust my surgeon.
Triana is a familiar face at her plastic surgeon's office.
Hey!
And since she's a family friend of her doctor's, she gets a discount for the fat grafting. It can cost up to $10,000.
Very exciting, very exciting. Plastic surgery is expensive if it's done well. It's definitely not something that you want to bargain shop for. I'm very blessed because I work really hard, and what I spend on surgery is my business.
Good morning, Triana.
Hi, Dr.
Hi, how are
Ellenbogen.
you?
After a short consultation, including computer renderings, Triana's surgery begins.
We're going to fill in her eyes over here.
The procedure is intense. Triana is knocked out with general anesthesia. A syringe is used to suck out the fat,
This is ready to get centrifuged.
which is then spun in a centrifuge to concentrate it. Injecting it into her face requires precision. There is no room for error.
This is a very precise part of the surgery. There's absolutely no leeway whatsoever.
Subjecting her body to all of this takes 2 hours. But for Triana, it's worth it if getting all this face work means looking better on Facebook.
Bye, guys.
For Nightline, I'm Cecilia Vega in Los Angeles.